Actually, I brought all our videos from our book so that it'll be at the video station, so you can look at some of those videos. If you want to request them, we can play them for you outside. I'm going to talk about hairline, which is really the cornerstone of good hair restoration. A bad hairline leads to just the most horrible results you can have. So this is the most artistic thing you can do here. There's probably an easy way to do it. People talk about the rule of thirds, just dividing the face into thirds. I personally don't like this because there's so much variability in the face, and with this third rule, I like personally just looking at imaginary 45-degree line from a horizontal to a vertical plane transition, and that's really where the lowest acceptable point of the center point is. It doesn't mean that you should start your hairline there. Most hairlines should start there, but it depends on the age, degree of recession, etc. That would make a judgment for you where to start, but it's a great starting point. So I always make that first mark, and again, it's a transition. Some people call it the shingling point, where it arches from forehead skin up toward horizontal scalp skin, and that's where the hairline starts. So you start from the center point. I'm going to show a video at the end of this which will bring all this together, because there's nothing like a video to describe it all, but I want to go through some of the points overview-wise. Then after you make that point, you really want to extend the hairline to its lateral most acceptable point, which is a line drawn through the lateral canthus. And this is why comb-overs look fake, or bad transplants look fake, is the fact that hair from the temporal area swept over to the midline, lateral to the lateral canthus, is not natural. Anything lateral to that is temple hair, anything medial to that is hairline hair. And then the central anterior point that's running somewhat through the either mid-pupil or the lateral limbus is just an arbitrary point that defines how you're going to arc that curvature going around, and I'm going to show you some ways to do that. So one is you can make a basic design difference, which is either this bell curve design or a round design. These are just, obviously there's a lot of nuances to this, but these are just two fundamental categories to make things easier in your brain. A bell curve design would be someone that you want to conserve grafts. They have a narrower head, and then maybe they have some temporal recession. You want to match the degree of temporal recession. The round design, maybe someone Asian such as myself with a wider head, more mature, stable temporal hair. You can actually get more aggressive in that area. The other thing that's so important is, the one thing I learned in the St. Louis workshop is when I see people draw the hairlines, they initially look really good, and then when you look at the side view, they look fake because the hairline arches down. And this is I see this over and over again. People draw the line and then I have them go to the side, look to the side, and it's going down. It should go up. And if you're being more aggressive, you could go flat, but it never naturally goes down. So always cross-check your side views. You must do that. Don't just draw the front hairline, accept what you've done. You need to look at it from almost every angle. One of the most important angles that I don't think is really presented too often in the literature is the mirror view. Why is the mirror view so important? The reason for this is that when you stand behind the patient, you put the mirror in front of both of you. This is how the patient sees themselves. Why is there a disconnect between what you see looking at him and what he sees in the mirror? The reason for this is one simple idea: the scalp topography. When the scalp is slightly different, it actually creates a different reflection in the mirror, and it changes the way a line looks in a mirror. So what I'll do is I'll draw a pretty quick line. It'll take me about a minute. I'll draw a line, be relatively happy with it, and I'll go to the mirror and cross-check it. It gives me two things: immediate feedback if I'm off, and are there scalp issues that are making this look off to me? So I'll use the mirror, redraw it, and wind up what I'll do is I'll have some kind of compromise between both of them, because obviously you want it to look relatively straight when someone's shaking the person's hand, and you want it to look relatively straight in a photograph and in a mirror view as well. And I tell the patient that, and one thing I like what my colleague Jerry Cooley said is that he actually has them close their eyes when he puts the mirror down first, because sometimes you draw this line pretty quickly and you look at it, it looks like that. So you want to just, before you go and show the patient that he thinks you're probably retarded, is you have them close their eyes, you look at it, make some adjustments until you're relatively happy, you have them look at it with you. But I do this very early on in the hairline drawing process, and I think it's very helpful as a cross-check, especially if you're at the earlier phase of your learning career. Temples, yeah, please.
I think one of the other things is when we draw a line in, we're looking at them, we're not seeing their other facial features, and we line up the hairline irregardless of everything else, the position of their eyes, the asymmetries, and we go ahead and we focus on the line that looks good. Then when we look in the mirror, and I do agree, I find this very challenging at times, because I think it looks great when you look at the patient from forward. I think what happens is when you're looking at it from a mirror, you're not just looking at the hairline anymore. We're not just able to focus our eyes there. We're seeing the whole face. So I think you're getting some feedback. I like your explanation that you're seeing the topography, but I also think it's a more global view.
Could very well be.
And therefore you throw off things. I've never heard that explained to me before.
That's what I came up with. And also the other way I look at it too is it flattens everything. Instead of looking at a 3D movie, you're looking at a 2D movie, and it just takes a line that is scrolling across a 3D landscape, and it just creates a 2D flattened view, and it gives you a very compressed view of your line. So I think those are the ways I look at it. I mean, there's probably many explanations, but I appreciate that interjection. The other thing that's really important is temple to hairline balance. You can't just draw this aggressive hairline when they have aggressive temporal recession. You saw Shelley's Uriflap talk where you see these temples start to recede, and what looked natural starts to look off because this is starting to recede. And a lot of times when you're looking at very current modern day hair systems that look very good because they're woven and they look natural, a lot of times the temples are off, and if you just transplant the temples, you can match out where the position of the hairline is to make it look more natural. So this is just showing you that if you make this really hyper-aggressive hairline and you have this receded temple that's in the dark, it won't look natural. The lighter gray is where it should be to match that degree of anterior projected hairline. One thing, we don't have a lot of time to talk about all the esoteric of hair restoration here, but I always try to emphasize safety. Don't start doing temple points. Don't start creating temples in your first, I don't know, 4 or 5 years of restoration, because you can create really bad results if you don't know what you're doing. It's very easy to create unattractive, ugly temples that don't age well. So be conservative with your hairlines. But you don't want to be so conservative with your hairline that you fail, like what I said in my consultation, to frame the face. If you're so scared that you draw this hairline way up here, it's not relatively where there's an aesthetic benefit to the patient. You're also failing the patient in a certain regard. You know, so you got to think about that as well. This is just a nice schematic from Amina in my book about just looking at different hairline patterns that you would draw based on the degree of recession the patient has, or maybe let's say how much donor capacity he has to rebuild it. If you're going to do a more conservative hairline, a more conservative temple reconstruction, that's in the pink. A little bit more relatively aggressive is in the green on the left side. So everything's got to match. Even your crown has to sort of match, because remember that first lecture I gave about Norwood patterns. If you don't understand the Norwood patterns, look at people that are naturally balding and look at how the temples flow. Study people with Norwood 1s, 2s, 3s, 4s, 5s, 6s, and 7s. And if you look at natural patterns, you'll begin to be able to recreate them much better and have an experienced transplant surgeon or someone critique what you do. And not to sell the St. Louis workshop, that's what you draw a line, I say it's wrong, and I'll have everyone else figure out what's wrong with it, and we'll work together, and in 5 minutes you get feedback to figure out what you're doing wrong. Because you may think you're doing it right, until someone feeds you back, you don't know what you're doing wrong. Brett, can you go and play the video?